Welcome to a steamy edition of DocTalk. No, I'm just kidding.
I actually like that.
I'm Lissa Kline. You'll notice these handy-dandy fans in our hands. We're not having coordinated hot flashes.
No.
It's a little warm in here. So if you see the fans, that's why. I'm really excited today to talk about 5 conditions that affect women more than they affect men. We're going to talk about heart disease, stroke, osteoporosis, thyroid disorders, and UTIs, or urinary tract infections. We know the stats are stacked against women, and we're going to get to that. But first, we know it goes beyond lifestyle and family history, and due to like hormonal changes, anatomical differences between men and women, and then the many stages of reproductive life. And I'm really excited to be talking to one of my favorite docs, Dr. Janet Choi, Chief Medical Officer at Progyny. So we're going to break down these conditions. Let's get after it.
And just as a little edit, it's not necessarily that heart disease and stroke happen more frequently in women, but sometimes they can actually, the reasons for why they have certain risk factors that might be different from men that we should just be aware of and to share with the population at large.
I love it.
Yay.
We're going to start with UTIs.
Yep.
A UTI, as I said, is a urinary tract infection. Tell me, Dr. Choi, what is that?
It is an infection, typically a bacterial infection of the bladder. And I think a lot of you probably don't need me to tell you what the symptoms are. It can be really painful, burning with urination. Sometimes as it progresses, it can just feel like constant pain. Like, I know I've had UTIs. I don't know about you.
Same.
But it's like I can't even focus on a conversation until I actually start getting treatment for it.
And a sense of urgency.
Yeah, urgency.
Yeah.
Sometimes, people will notice blood in their urine. Sometimes they'll notice that their urine smells kind of funky or looks sort of like cloudy.
Why are women more predisposed to UTIs than men?
So probably a variety of different factors. One, the urethra, so that little tube that connects the opening of the bladder to help the urine exit your body is shorter in women than in men.
Yep,
right.
Got it. And why do UTIs increase with age?
So the hormonal milieu change in women, especially with like the changes in estrogen as we go through perimenopause and menopause, and that might also change the increase the proclivity for people to develop UTIs. During pregnancy also, we are also more prone to sometimes developing UTIs.
Yep.
So yeah, all those different things.
And if left untreated, besides the pain, what are the dangers?
So again, that's actually a great question because, it's a UTI, and if you can get readily available antibiotics from your doctor, if you have a stash.
And that medication that makes your pee orange?
Oh yeah, so there's Pyridium. It doesn't cure a UTI, but boy, does it help you feel better while you're waiting for your antibiotics to kick in.
Yeah.
It makes your urine turn like Tang colored,
yes.
which is an old school orange drink. All right, so back to the importance of why you should treat a UTI and nip it in the bud. So for women who have a urinary tract infection in pregnancy, if it doesn't go treated, it can actually sort of, I tell people, can climb up into your kidneys, cause pyelonephritis, might increase your risk for preterm labor, preterm delivery, not a good thing. Older women, too, oftentimes will manifest, especially post-menopause, with other symptoms, milder symptoms, and it can actually lead to body-wide urosepsis infection.
Yeah.
So these are all potentially quite dangerous to the health.
So you should treat it if you have, see a physician, even urgent care.
Don't blow it off.
Yeah, don't blow it off. And how could you prevent getting them? What are ways that you can help avoid them?
Sometimes I've had patients ask me, if I just keep myself clean, should I be douching? I'm like, absolutely not. Don't be douching. Try to use cotton underwear, right? If and when, hopefully you are sexually active.
Yep.
What I encourage patients to do is to get up right away and actually pee. That helps flush out some of the bacteria so they're not crawling up into your urethra. I know, sorry. Thanks for the graphics there. The other thing I also encourage patients to do is you can take a warm, clean, washcloth and just quickly swipe from front to back.
Yep.
Make sure when you're wiping that you don't wipe from back to front. And the reason why that's really important, it's not an old wives' tale, is you don't want to get the bacteria from the fecal material right around your anus getting swept up into the urethral area.
Right. So practice normal hygiene, wear cotton underwear if possible, no douching, and if possible, pee after sex.
Exactly. There's something else that people sometimes ask me about. Does cranberry juice cure UTIs? No. There is some mixed There are some mixed studies out there. May not be a bad idea. I read up on this a while ago. Cranberry juice might have certain chemicals where it makes it harder for the E. coli bacteria to, I like picture like these little bacteria crawling up the urethra from crawling up the urethra into the bladder, inciting an infection. Again, debatable, but probably not a bad idea to consider also.
Yeah, a benign treatment that may help.
Yeah.
You'd probably have to get incredible amounts of cranberry juice,
probably.
but whatever. Okay, moving on.
Yes.
Thyroid disorders.
Thyroid disorders.
So this is one we hear a lot when you and I used to work together. That's your thyroid?
Thyroid is right here. Okay.
We used to work together. This was a very common, almost every patient we saw would have a thyroid check in the fertility setting. So what is a thyroid disorder, and what does that mean to me, who knows very little about it? That's not true. I know a little bit.
You know a lot.
I know a lot.
So, thyroid disorder. So, the thyroid is a teeny tiny gland that sits right here at the base of the throat. Both men and women have one. Women are actually more prone to developing thyroid disease, I think 5 to 8 times the prevalence of men over their lifetime. And there's both hyperthyroid activity. One common sort of terminology that's used for common hyperthyroidism is Graves' disease. And then also there's hypothyroid activity. So hyperthyroid activity is just like a hyperactive kid. If you have a thyroid gland that's putting out too much thyroid hormone, you can have symptoms of unexplained weight loss. You might have problems sleeping. You might feel like more tremors or palpitations. Some people will also have some ophthalmic or eye issues as well. And then on the other side, if you have hypothyroidism, so you have more of a sluggish thyroid, so not putting out as much thyroid hormone as it should be, then you can have other symptoms like potentially like mild weight gain, gastrointestinal like symptoms like constipation, feeling a little bit more low energy and sluggish, potentially even some symptoms associated with like maybe what might feel like low energy and maybe even like low depression. So again, symptoms and disorders that we need to pay attention to and manage to make sure your thyroid is euthyroid, EU thyroid. Yeah.
And in pregnancy, you want your thyroid before, as you're trying to conceive, to be checked, and then especially in early pregnancy, because it can impact pregnancy loss.
So it's interesting. So the U.S. Preventive Task Force, when it puts out guidelines, you know, they weigh the risks and benefits of different tests and interventions, as well as the cost of testing and how does it benefit the entire population. I don't think, and we need to fact check this again, I don't think they recommend that every woman across the board gets their thyroid checked.
Okay, good to know.
But we definitely do in the infertility world, because we know that an unregulated thyroid, whether hyper or hypo, can actually lead to infertility as well as pregnancy problems. So we always like to check it. We're doing all sorts of other blood tests, so why not add one more lab test? And it's a useful thing to screen for. And yes, ideally, if we detect a thyroid gland that's out of range and function, we want to try to normalize that safely.
And how do you normalize that? With medication is one way. Are there any other ways someone can manage thyroid disorders outside of that?
That is a good question. There are potentially some supplements that can interfere with your thyroid lab tests. So you have to make sure that when you are getting your thyroid blood testing done, to share with your physician what additional supplements you might be on, because again, I'm blanking on which ones. They can actually give you a falsely abnormal thyroid lab read.
Got it. TSH. And if you have thyroid issues, you would see an endocrinologist.
But a really good primary care doctor, reproductive endocrinologists also are used to managing sort of the garden variety of subclinical hypothyroidism that frequently presents. So but you definitely want to connect with a provider.
Love it. Okay, moving on. Next, osteoporosis. So fun.
Oh, yes.
Bone loss. So why are women more likely to experience osteoporosis in their lifetime?
Okay, so this is where I want to share, not that I love these stats, but super important, right? So the prevalence of osteoporosis in the over 50-year-old crowd in the U.S. is about 12.6%, and women have about a 20% prevalence over the age of 50 versus men, where it's 4.5%. So men can actually also manifest and develop osteoporosis. And basically the reason why we're worried about osteoporosis is it's a weakening of the bone structure, demineralization, and it's not just that, it puts that person at higher risk of fractures. And there are many studies that demonstrate that morbidity and mortality from weakened bones, like fractures, can lead to more complications, more morbidity and mortality as adults age as well. So again, something else that we need to be mindful of.
So your bones are more fragile because they're more brittle.
They're demineralized.
Yeah.
So basically, women, particularly as we enter perimenopause and menopause and our estrogen levels drop, and estrogen is actually a great bone sustainer,
Right.
We end up losing bone mass pretty quickly, whereas men might have with aging a steady, slow decline in bone loss, but the testosterone also helps with their bone strength maintenance to some degree.
And would a menopause provider recommend hormone therapy to keep estrogen to help avoid osteoporosis?
So this is interesting. So one of the reasons why someone might consider hormone therapy is typically nowadays, when you look at the guidelines, not as a primary concern of osteoporosis prevention. However, if you're going to your doctor saying, I can't sleep, I'm really angry with everybody, I can't seem to function very well, I'm having all these hot flushes, if menopausal hormone therapy is a potential treatment, secondary gain is it may also be a useful tool in osteoporosis prevention.
Got it. Love it. And to check osteoporosis, you would have something called a DEXA scan.
So yes, it's a dual energy X-ray absorptiometry. That's kind of a tongue twister.
You could just say
especially as
DEXA.
a DEXA scan.
She's a show-off.
I am. Sometimes, but not always. So it's a DEXA screen.
Yep.
And so typically for women of regular risk, low risk, it's starting at age 65. Although if you have other risk factors like you've had a low risk, low trauma fracture, meaning a fall from like just standing, like not like you got run over by a truck and you break a bone, that could mean that you're potentially at higher risk for osteopenia or osteoporosis. If you've had a parent with a hip fracture, that puts you at higher risk for osteoporosis. So that's another reason to talk to your doctor about an earlier DEXA screen. If you've been on a long-term regimen of steroids, right, or if you have diabetes, those could be other reasons to potentially get a DEXA sooner.
Awesome. Okay, moving on. Heart disease.
Wait, stop.
Wait, stop.
Okay, to tie some like connecting topics together, I forgot about thyroid disease can also increase your risk for osteoporosis. So that's the other reason why you want to make sure your thyroid is well managed.
Heart disease.
Yes.
So you mentioned as we started that women don't necessarily have higher risk of heart disease or disproportionate heart disease, but that symptoms can be different and maybe missed.
Potentially. And some interesting, not interesting, I mean, these are like heart-stopping facts. A lot of women think and worry constantly, right, that cancer is the number one cause of death. And they're like, I don't want to die, I don't want to get cancer. Like, but did you actually know that the number one cause for death in women is actually cardiovascular disease, right? And not just for older age women, like there are a significant proportion of women over 20 have some underlying heart disease as well. And I think I saw that stat from the American Heart Association where close to 50% of women entering pregnancy
I saw that.
have some like underlying heart disease issues,
health.
right?
Yeah.
So that's
which was really surprising to me.
Yeah, and the reason why that's so concerning is a lot of the maternal morbidity and mortality is related to cardiovascular disease as well.
And pregnancy puts stress on your heart, right?
It's like a major workout for close to 10 months.
Yeah. Okay, so 10 to 20% of women will have a health issue during pregnancy, including high blood pressure, preeclampsia, gestational diabetes, and all of those impact potentially cardiovascular health. Is that accurate?
Yep.
Yeah. In midlife, so outside of pregnancies, but midlife, sort of that menopause transition, why does heart disease accelerate there? Is it just age?
So there's probably a combination of factors. There's probably that change and hormonal shift that women experience as their estrogen levels drop that might actually predispose them to, so leading up to menopause, for instance, women in general compared to men have lower risks for cardiovascular events. But once we enter menopause, as our estrogen level productions go down, then our risk kind of levels out as kind of on par with men. And it's a combination potentially of that hormonal drop, as well as a lot of women during that time frame may experience weight shifts upward. So weight gain also predisposes you to cardiovascular disease. Also metabolic disease like diabetes, it increases as well, which can also contribute to your cardiovascular disease risk factor.
So weight is one that we talk about a lot for just overall health. I think there's controversy maybe around using BMI as an indicator because it's not perfect necessarily. But how does weight affect your heart, and what are sort of ways that you can minimize weight if
Well, you don't
the
want to
case for you.
minimize your weight and whittle away to nothing. But I think if you've been told, or if you're aware because you've done your own self-assessment, because you're like, what can I do to just be healthier, and you calculate that your BMI is in the overweight or obese range. So is it over 25, and then also over 30 for obesity?
Yeah.
There are many studies that suggest that obesity is not just a risk factor for heart attacks, but also a risk factor for stroke. And so getting, even losing like a small percentage of your weight through more regular increased moderate exercise activity, 150 minutes per week, at least. Also eating more healthy, Mediterranean type plate eating, and there are a lot of guides online you can find for free.
Yep. Less processed food, less trans fats.
Less red meat, right? More lean animal protein like chicken and fish, more fiber in your diet, less processed sugars and carbs. That might also contribute to not just weight loss, you can get into a healthier range, but improving your heart health and lowering both your heart attack risk and your stroke risk.
So knowing that heart disease is a leading cause of death in women, as you helpfully outlined, what are some ways outside of nutrition, which we covered, outside of weight management, what are some ways like for body literacy and other lifestyle modifications that a person can help prevent? And then how do people talk to their doctor about their risk factors?
Both great questions. So for starting at home or by yourself before you even see your physician, while you're waiting to see them, take a look at what your lifestyle habits are. Are there some factors that you might have some control and agency over that you could try to eliminate? For instance, if you're a heavy alcohol consumer, increases the risk for falls as you get older, osteoporotic fractures, increases the risk for heart disease and everything. Try to work on cutting that out, right, or reducing it greatly.
Minimizing.
Also, if you're a tobacco user or other substances, vaping, we have less data, but probably in the same category. If you could try to eliminate those, that can also improve your risk factors for some of these issues that we've discussed today, right? And then make sure that you sit down and I oftentimes find that it's helpful to go into a doctor's office with a list, maybe on your phone, just kind of typed out, of questions or issues around, what kind of health issues that do you want to discuss today? What are some of the family risk factors? Hey, I had someone who fell and broke their hip at age 65. My parents died from early heart attacks at age 55 and 65 or whatever, and make sure you bring that up so that way you don't miss talking about something that's really important to you and your health.
And blood pressure monitoring, is that more for strokes or is that also for heart?
It's for both, right? Blood pressure monitoring, so your doctor will, when you go see them, check your blood pressure. Ideally, you want to aim to keep a blood pressure under 130/80, ideally even under lower systolic level, under 120, 110 is even more ideal. Also want to make sure that your lipids, your cholesterol are well controlled. Higher LDLs can actually increase your risk for heart disease and stroke. So working with your doctor, if your doctor says not only should you be looking at diet and exercise and weight loss, but using a statin might be very useful in bringing your cholesterol into a healthier level, then I'd probably follow their instructions.
Yep, love that. So related, we talked about heart disease, moving on to stroke.
Okay.
So women are generally at risk for stroke, like everyone is. In pregnancy specifically, preeclampsia, gestational hypertension, and postpartum clotting are all risk factors for stroke.
Migraines also, with auras especially.
Oh, interesting.
Yeah.
I didn't know that.
Yeah.
After in the midlife stage, so menopause and beyond, does taking hormone therapy help a stroke risk factor or worsen it?
That is a great question. So being on a combination, understand these risks that are increased are really small, so you have to have a really open conversation weighing all the risks and benefits. Birth control pills can increase your risk for stroke very slightly, but for the vast majority of women, the benefits, having unwanted pregnancy, having complications from that, far outweigh any small risk for a stroke. There are some patients where it's really, the risk is not worth being on the pill, right? And I'm bringing up the pill because it's a useful contraceptive item, but it's also used by physicians sometimes to help women control their symptoms in the perimenopause as well, right?
For me, that's what my doctor put me on.
Low-dose birth control pill, right? But, if you are over the age of 35 and you're a migraine sufferer and you smoke, these are conditions where, a combination of different medical conditions where your risk for having a stroke is just far too high, and so your doctor will say, don't be on the pill. Yeah.
People are still smoking in 2025.
Okay, yes.
And I think that is arguably one of the, I won't say it's easy to stop smoking because it's an addiction.
It's not. It is
but
very
it is
hard
arguably one of the best choices you can make for yourself, for your fertility, for your heart health, for everything.
Absolutely.
Also, they're expensive. I saw recently they're like $20 a pack or something.
So understanding that it is very hard to quit.
Yes.
There are lots of great reasons to really think about. Today's the day that I want to think about working towards no longer being a smoker.
Yeah, tobacco.
Yeah, and by the way, it's not like give up and just roll over, because some people are like, well, I'm already at higher risk. You know, these two are just telling me that I'm a higher risk for stroke and heart attack. I might as well just keep smoking, right? There are studies that show that once you quit smoking, right, your risk for all of these events actually kind of go down over time, to the point that I think after like 5, 10, 15 years of not smoking, it's almost like you'd never smoked before for some of these medical conditions, right?
So you can make it better.
Yes, you have some control.
And then same preventative measures for stroke would be like healthy diet, movement, some sort of exercise, whatever works for you.
Yep. Blood pressure control.
Yes, blood pressure control.
Yes, we know you're a big self-cycle queen.
But not everyone does that. So if walking is your thing, if
gardening.
I mean, how much movement is that really? But,
I mean,
okay, fine.
like you're kind of shoveling out the
What kind of garden do you have?
Oh, no.
I was picturing like this. We're gardening. We live in New York City. It's weird.
Anything that kind of gets you up and moving and maybe kind of breaking out into a modest sweat.
Yep.
Although not sitting in this room right now, which is like 88 degrees, right? Yeah.
Yes. This was really helpful, and I learned some things, which I normally do when we DocTalk, but I appreciate it. And so that's a wrap for 5 conditions that women are facing more than men. As usual, the video is not intended to scare you about your health and worry you, but rather give you things to talk to your own doctor about and modifications that are some relatively easy that you can do to improve your overall health.
Yes.
Because we want you around. If you're a Progyny member and you're looking for guidance, you can talk to your PCA, who can help provide education, support, and content to help. And as always, I love talking with you, even when it's steamy.
I know. There we go.
It's really warm in
here.
We love talking with you. Thank you so much for joining us. As always, if you have things you want us to talk about, drop them in the comments. We love to hear from you. And thank you. See you next time.
Bye.